can also ask for request for labs to also assess. Please, that's the little I know.
Okay, so I mean, in general, we say that you ask questions. Thank you very much for the adapt. In general, you say you ask questions, you interview the patients, right? It's all about interrogation, and also someone also said you um, um, what do you do? You said you assess patients, or what did the first person say? You check patients. What? So you observe. You mentioned something like you observe patients,
I say
right?
you observe
Physical
patient
aspect.
general appearance, the
Very good.
appearance of the patient.
Very good. Very good. And then, do you know that the assessment can also be like you using some equipment like the stethoscopes, the BP apparatus, the thermometer? It's all about assessment, right? You are assessing the patients using those equipments. So let me just delve into this. The assessment, or let's say patient problems, when you are trying to get patient problems, the patient problems can be divided into two, being objective and then what, subjective. So we've not gotten there yet, but before we get there, I want to let you know this. So you have to uh, the things, the patient problems you are going to discover, you the nurse, you're going to discover, they are what, objective ones. You saw on the patient, you asked patient and patient told you. Like, I mean, no, not like patient told you. You saw on your patient, on the patient, you checked patient vital signs and you saw that, you recorded that, so it's what, objective. And then the one that patient will tell you that, oh, I am having pain, I'm having pain, that is what, subjective. So you call it subjective what, data, or subjective patient problem. The objective ones are the ones that you, the nurse, you will discover on the patient. So patient is having a high body temperature, it's an objective what, patient's problem. You, the nurse, you saw it. Patients cannot tell you. Okay, patients can verbalize that he feel warm, or he feels what, hot. That one too can be what, it can be subjective, as well as it can also be what, objective as well. You, the nurse, you can discover, and the patient can also tell you. And then we have acute pain. Pain. Let's say a patient says that I'm having headache. You, the nurse, you cannot see that patient is having headache. The patient has to tell you. Patient says that I feel dizzy. I feel dizzy. Yet the nurse, you cannot get to know that patient is having what, dizziness. No, the patient has to tell you for you to know. In that case, it becomes what, subjective what, data, or subjective problem. Is that well understood? Okay. Then you go to your diagnosing, planning, implementing, and evaluating. Diagnosing, we are going to use the NANDA to do our diagnosis. That is for what, the nurses. And then planning, that is how you are going to what, plan your treatment, and also look out for the expected goals. After all the things you want to do for patients, what do you expect to happen? So if patient is having difficulty breathing, what do you expect to happen to patients after all the necessary interventions you want to give to patients? What do you expect to happen to the patients over there? You see, so that is the expected outcome, or the outcome criteria. So I will show you the care plan sheet, then we break it down. We break it down. All right. I just want you to have a clear or a generalized idea about the nursing care plan. That is why I'm taking you through this. Is that understood? Hello, is that well understood? Okay.
Yes, please.
Yes, please.
All right. Then you go to your implementing. So this is where you are going to, I mean, ensure that you intervene for patients. All the plans that you have, you implement them to ensure that patients what comes out of the difficulty breathing. And then the evaluation. This is where you conclude whether all the things that you did for your patients has worked successfully, or have been what, effective or not. So let's continue. Yeah, the types of nursing. Okay, what is a nursing care plan? Let's start from here. What is a nursing care plan? A nursing care plan, or NCP, is a formal process that correctly identifies existing needs and recognizes a client's potential needs of or recs. So care plans provide a way of communication among nurses, their patients, and other healthcare providers to achieve healthcare outcomes. Without the nursing care plan planning process, the quality and consistency of patient care would be lost. Nursing care plan begins when the client is admitted to the health facility and is continuously updated in response to the client's changes in condition and evaluation of goal achievement. Planning and delivering individualized or patient-centered care is the basis of excellence in nursing practices. Now let me tell you this. You can learn all the anatomy, you can learn all the pharmacology, you can learn all the what else? The applied physics, applied chemistry, and a whole lot. Physical assessments, you can learn all of them. But without you knowing your nursing process or nursing care planning, you cannot care for a patient, for the patient to get well. Because if you don't know nursing care plan or care planning, how will you know that a patient has come, patient is having high body temperature, I should do this step by step, or in a systematic way to reduce this high body temperature? How would you know? Or you just go because you've learned pharmacology, you just prescribe any medication for the patient, paracetamol to put the patient's liver and kidney at rest? Is that what you want to do? No, you have to know care plan very well. Okay, so it starts from somewhere. That's why we say what it is: a process, nursing process. You assess patients, you check the patient's body temperature to ascertain that all the things that you've gotten are true before you go ahead to do all the non-pharmacological stuff to see if patient's body temperature is going to reduce or not. If it doesn't reduce, then it could be that patients might be having infection in the body that is causing the high body temperature. Then you can what? Introduce your pharmacological treatment or pharmacological therapy. So nursing, understanding the nursing care plan is very, very important. That is why I took my time for 2 years now to develop this very masterpiece for all of you or everyone. So you can come and then grab a copy. Now, types of nursing care plan. Like I said, care plans can be informal or formal. An informal nursing care plan is a strategy of action that exists in the nurse's mind. An informal nursing care plan is a strategy of action that exists in the nurse's mind. That one is informal. You have it in your head. Oh, okay. Okay, then let me do this. Let me do this to this patient. It's in Nipan Wapano. So what do you think you want to do? You want to splint. Sending an Nipanon and cause further damage to tissues and blood vessels. You want to do splinting for the patient. Oh, okay. And only something that you have not documented, something you've not written. So is what? An informal what? An informal nursing care plan. Is that understood? Now, the formal one, let's come to the formal one. A formal nursing care plan is a written or computerized guide that organizes the client's care information. So this one is a well-organized one. It's a formal one that you need to go according to that, step by step, to make sure that this patient gets well. So formal care plans are further subdivided into standardized care plans or individualized care plans. Standardized care plans specify the nursing care for groups of clients with common needs. Individualized care plans are tailored to meet a specific client's unique needs or needs that are not addressed by the standardized care plan. Let's look at the standardized one. Standardized care plans are pre-developed guides by nursing staff and healthcare agencies to ensure that patients with a particular condition receive consistent care. These care plans help ensure that minimally acceptable criteria are met and promote efficient use of the nurse's time by removing the need to repeatedly develop common interventions for many clients on a nursing unit. However, standardized care plans are not tailored to a patient's specific needs and goals, although they can provide a starting point for developing an individualized care plan. Care plans listed in many nursing guides are standardized care plans that serve as a framework for developing individualized care plan. So when we come to standardized care plan, let's say you've opened a book. I have this book as a soft copy, which I think is 11th something edition of Brunner something, and this one, it is standardized care plan. So let's say it is about respiratory problems, difficulty breathing. They will just tell you, take x-ray or take patient to x-ray department for whatever, for images to be done. Just tell you that you can ensure that patient takes adequate fluids or copious fluids. You can ensure that patient you can administer oxygen, blah blah blah. It's a general one that they give you. It's not specific. So let's say you are learning something on asthma or pneumonia or COPD, chronic obstructive pulmonary disease, or let's say pleural effusion or acute coronary syndrome. These things, remember, with generalized one are between the treating respiratory problems, but not necessarily say individualized one. So the individualized one, that is the one we are going towards focus. The standardized one, they give us like as a basis. You understand? That is a fundamental or the foundation that we should build upon to develop individualized care plans. That we know that when somebody is having difficulty breathing or respiratory problems, you have to administer what? Oxygen. We know that when someone is we know from the standardized one, we are treating or we are giving individualized care to this patient, and we know from the standardized one that when somebody is having a difficulty problem, we have to check oxygen saturation. We have to put patients in a farless position. You see, if somebody is having this thing, a heart problem, we have to put patients in this thing, cardiac bed. We need to provide a heart table. You see, someone is having hypertension, we have to put, restrict patients from high sodium diet intake. You see that thing? So it's a generalized something that helps us to build upon to develop individualized care plans. Is that well understood? Okay. Now, the individualized care plans. An individualized care plan involves adapting a standardized care plan to meet the specific needs and goals of the individual clients and using approaches shown to be effective for that particular client. This approach allows for more personalized and holistic care that is better suited to the client's unique needs, strengths, and goals. Do you understand this point very well?
No, please.
You don't understand? can somebody read the one who said no, please? Can you read that? Can you read that part for us? Kindly read that part for us. The one I read, the individualized care plan. Kindly read that for us.
Okay, so individualized care plans, right? An individualized care plan involves adapting okay. An individual care plan involves adapting a standardized care plan to meet the specific needs and goals of the individual client and using approaches shown to be effective for that particular client. That is Henkel and Tiva 2022. This approach allows for more personalized and holistic that is better suited to the client's unique needs, strengths, and goals, ANA 2021. Additionally, individualized care plans can improve patient satisfaction when patients feel that their care is tailored to their specific needs. They are more likely to feel heard and valued, leading to increased satisfaction with their care. That is for SR 2021. This is especially important in today's healthcare environment, where patient satisfaction is increasingly used as a measure of healthcare quality.
Okay.
Should I
So,
continue?
oh, yo, no, 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 no.
Okay.
Let's end there.
Okay.
Kindly end there. All right. Let me. Did you understand that? Did you understand what you read?
Yes.
Okay.
So with the individualized care, it means that you have to treat each patient according to his or her needs.
Mm-hmm.
So if you are so it should be like a holistic care. So if this patient complains of headache and this patient complains of let's say stomach pain, you have to treat according to like you treat each patient individually. I don't know even how to say it
Okay.
correct.
So let me come in. You see this
um,
headache that you used here.
yeah.
The reason they are saying it should be, it is they've termed it as individualized care plans, is that you see, someone can be having headache, eh? Another person too will have their same headache, but the root cause of the headache is different. The person having the headache could be, let's say, somebody having high blood pressure, right? In which there is increase high blood pressure, or let's say increase intracranial pressure that is causing the headache. Someone also could be having headache, but the root cause of the headache is because there is insufficient blood supply to the brain. Someone can also have headache, and the headache can be as a result of what? Insufficient did I say oxygen or blood supply earlier? I mentioned blood supply, yeah. It can be insufficient oxygen supply to what? To the brain. It can also be that this patient has been using screens, okay? Screens, phone screens for so long, or this patient has not been getting enough sleep that is causing the headache, or this patient has been engaging himself or herself in strenuous activities. This person has been exercising for a whole day without having rest. This person could be having infection in the what? In the body that is causing the headache. So you treat it depending on the individual needs. Is that understood? So somebody is having a stomach ache. Another person too is having the same stomach ache. What could be the result of? The person could be having infection, okay, happening. This infection is definitely causing inflammation. Somebody too has not eaten for days, and immediately he or she ate the food. That is a moment that the intestines were trying to open, or let's say the stomach was trying to open, so that was what was causing the stomach ache. Someone also had diarrhea, or someone was also having diarrhea and has eased himself or herself for several times. That was why the person was having the stomach ache. But this person could, or another person could also be having what? Cancer in the in the intestine, or the GIT. You see, they all have different root causes. These root causes is where we are going to discover them to be to be the related factors. Is that understood? Okay, so now you understand why we are saying care plans should be individualized, or the reason we are terming this as individualized care plans. Do you now understand? Do you now understand, please?
Please.
Oh, okay.
Yes.
Okay. Thank you. All right, let's proceed. Tips on how to individualize a nursing care plan. 1. It says perform a comprehensive assessment of the patient's health. So the history, health status, and desired goals must be known. Involve the patient in the care planning process by asking them about their health goals and preferences. By involving the client's nursing process, the client's nurses can ensure that the care plan is aligned with the patient's goals and preferences, which can improve patients' engagement and compliance with the care plan. Perform an ongoing assessment and evaluation as the patient's health and goals can change. Adjust the care plan accordingly. So this patient's care plan has been done for the patient. Now we've planned care for the patient. We are trying to plan care for the patient. These are the things that we can go through to plan the care for the patient. You have to know the patient's health history or health status and desired goals, the things that we want to achieve. You have to involve the patient in it. So in that case, patient too will get involved. You have to converse with the patient. Oh, this is what we want to do to you. Are you allergic to this? Do you like this? According to your religion, do you believe in this? You see that thing? So this is individualized care. We want to give you metformin. We want to give you Cipro. Are you allergic to any of these medications? Individualized care. You see that thing? So with a generalized or the standardized one, they will just say that if there is an infection, you should administer antibiotic. So the Cipro is an antibiotic, a broad spectrum as that. So when you have a patient who has infection and you know that after you've done your test, you know that the Cipro is the one that can treat the patient, then you choose the Cipro. That becomes individualized care. Is that all right? Now the objectives. Let's look at the objectives. The following are the goals and objectives of writing a nursing care plan. So this is, they say 1, promotes evidence-based nursing care and render pleasant and familiar conditions in a hospital or healthcare. Support holistic care, which involves the whole person, including physical, psychological, social, and spiritual. You see that thing? I mentioned something about religion earlier, with the management and prevention of the disease. Establish programs such as care pathways and care bundles. Care pathways involve a team effort to reach a consensus regarding standards of care and expected outcomes. In contrast, care bundles are related to best practices concerning care for a specific disease. Identify and distinguish goals and expected outcome. It reviews communication and documentation of the care plan and also measures care, nursing care. Purpose of nursing care plan. It defines nurses' role. It provides direction for individualized care of the client. Continuity of care. Coordinates care. Documentation. It serves as a guide for assigning a specific staff to a specific client and also monitor progress. It serves as a guide for reimbursement. So the insurance companies use the medical records to determine what they will pay concerning the hospital care received by the client. So the patient has gone through several procedures. Oh, which one can we, the insurance companies, pay for it? You see, then they will take care of that. So somebody is having hypertension, or call hospital and say, oh, you might be brainy, you know, if the insurance cover, we insurance and cover. You see that thing? So you see nursing, importance of what? Nursing care plan. You see, let's continue. Then defines clients what goal. It benefits nurses and clients by involving them in their treatment and care. All right, let's look at the components of the nursing care plan. So this is how we're going to delve into it. The nursing care plan usually includes nursing diagnosis, clients' problems, expected outcomes, nursing interventions, and rationales. These components are elaborated on below. Like I said, I mentioned assessments earlier, and they are all found here. So let's quickly jump all over these. And come here. Let's come here. The top there, we shall go there. So we have types of care plan formats. We have the 3 columns. We have the 4 columns. So we are doing the 4 columns. So this is how it should be. The 4 columns, we've added some to it, making the 6. Okay, we've added some to it, making the 6. Okay, let's put the assessment aside. So on the nursing care plan sheet, we're going to have diagnosis, outcomes, nursing orders, interventions, and then so let's say the 5. These are the 5 that we are going to look at. There's a template. You can change it or modify it. It's here. The instruction is somewhere here. It said below is a document containing sample templates for different nursing care plan formats. Please feel free to edit, modify, and share the templates. That is why we have the standardized ones, or let's say the types being the 3 columns and then 4 columns. But during examination on the care plan sheet, you find 5 columns on it. Okay, 5 columns. Put the date where you put the dates and then time aside. But the major ones are 5. I think yes, that's it. So we have diagnosis. You have your nursing diagnosis. You have the outcome. You have the nursing orders, interventions, and then evaluations. Let's begin from the front page of the nursing care plan, and we will go back to learn a few things at the top there, but let's begin from the front page of the care plan sheet, so that we know that today we've started from somewhere, tomorrow we are continuing to actually arrive at a satisfactory point. All right, can you all see? Can you see?
Yes, sir.
Very
Yes,
good.
Yes, sir.
Very good.
Yes, please.
So then, this is the front page of the nursing care plan. This is the one I drew myself. So you can see my logo there. Nursing care plan. Alright. So with the nursing care plan, there is a breakdown here. Let's start with that. So you have to write the name. You can see the name over here. But when you are given the care plan sheet, you'll be told to write your index number and then you sign. So this after that the care plan will begin. So when you are done writing your index number, then you sign, you provide your class, your program, the lab you are assigned to, okay, and even the ward, you provide all of them on the sheet. Now the name over here is not, so when you are able to fill all of these data here, you'll be awarded 1 mark. The name over there is not your name, is the patient's name, personal data. So you write the patient's name there, the ward number there, the bed number also there. Inpatient's number is the folder number, the age of the patient, the sex, religion, if patient is a Muslim, if patient is a Christian, a Buddhist, and so on. It is whatever. The occupation of patient too must be there. You see that thing? Occupation of patient must be there. Diagnosis, the diagnosis too must be there. If patient is suffering from hypertension, you write it there. If the case is a surgery case, you write it there. Mastectomy, laparotomy, whatever, you write it there. If it is breast cancer, you write it there. If it is mastectomy, you write it there. If it is diabetes, you write it there. Then you come to the physician or the surgeon. This part is where you write the name of the doctor that is taking care of the patient, or that diagnosed the patient of such condition. Then over here, if the case is a surgery case, or there will be any surgery to be conducted for this patient, you name or you write the type of surgery for that is to be done for the patient at the operation side. So if it is those surgery that I mentioned, mastectomy, hysterectomy, and so on, you can write them there. If there is none, if there is no operation, you write not ordered. If there is no operation, you write not ordered. Date of admission. So with this explanation that I'm giving you, if you buy the book, you find all of them in it. So look at it, they are all here. They are all here. So let me, for instance, the operation, indicate the kind of operation done, if it is a surgical case or blah 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 blah. Yes, it's there. So when you buy the book, you find all of them there. Yes, how to I even discover patients' problems and so on. You find all of them there. So when you get a copy, you have all of these things to get them on your fingertips. So the date of admission is the date that patient was admitted to the ward. Then date of discharge, patient is not yet discharged, so you write not yet, not yet. Now let's come to patient problems. How do you find patient problems? Based on assessment, like we said, you can be interrogating patients. You can assess patients using what? Interviews. You can ask patients about his or her health status, health history, and so on. You can assess patients using equipment like stethoscope, thermometer, the sphygm, and so on. The oxygen saturation, the glucometer. These are all equipments to assess patients. And mind you, don't forget that these patient problems that we spoke about are grouped into two: subjective and objective. And what did I say the objective data is called? What did I say the objective data mean? What did I say the objective data mean? When we say objective data, what does it mean? When we say objective data, what does that mean? Or objective patient problem. You say patient problem is objective. What does that mean? I mentioned that earlier. When we say objective data, what does that mean? Can somebody help us? The data the nurse obtained. Okay, Beatrice, that's correct. The data the nurse obtained. So it is the data. Okay, Patricia Awusi Man Randolph. You can come. You can
So
speak.
please, what you observe on the patient.
Okay, what you observe from the patient or you observed on the patient. Very good. So that is what you, the nurse, you see, you observe on the patient during your assessment. Okay, whether you using your eyes, you're doing the this thing, inspection, palpation, percussion, auscultation. You see, you are inspecting using your eyes, so you see that patient is having impaired skin integrity. Patient is having some dark spots on the skin. Patient is having rashes or eczema. You see, patient's skin is impaired. So that was through what? Yes, that was through observation or inspection. And then percussion, you percuss patients what? Ribs, percuss patients what? Back, the spine, and so on. And you realize that the sound isn't the one that you expect. You actually palpate. You realize that there is a mass, there is something like a bulge somewhere. So these are all procedures or techniques that will help you with get problems or discover patient's problems. And then we have auscultation. This is where you are going to what? Use your stethoscope to what? To auscultate. You listen to bowel sounds and so on, heart rate or heart sounds using the stethoscope. Is that understood?
Yes, sir.
Yes. Then someone also mentioned using the devices. So like I said, the thermometer, the sphic, and a whole lot. Let's proceed to patients. Okay, let's continue again. Still on the patient problems. Now, these patient problems, you cannot just state them like that. You have to arrange these problems because patient comes to the hospital with lots of problems. Which one do you have to attend to first? So when you get this book, it has all of these things in it. The ones that you have to prioritize first, and how you prioritize your patient problems using the ABCs, the airway, breathing, circulations. And with the book, it also has something that says that risk problems should be addressed first, or should be prioritized over actual problems. Risk problems should be prioritized first. So someone is having something like someone is vomiting. Somebody is vomiting. The person is vomiting, losing fluids, or the person is having diarrhea, profuse diarrhea. It's a risk or something that is posing the patient to what? To losing lots of fluid from the body. You have to prioritize that over any other patient problem, provided that is the instance you realize that this patient has been losing lots of fluids, and when fluid is lost, the patient can be dehydrated. With these patients can actually enter into hypovolemic shock, and that is going to be a complication. So then, if you don't solve the risks, you are going to have the complication to happen. So it is necessary you prioritize the risks. So when you buy this book, everything that you need to understand is found in there. When it comes to that part that you have to prioritize the risk problems over the actual problems, you have it there. And then the airway that we were talking about, airways. You know that anything that has to do with the airway, anything that has to do with breathing, you have to You have to take care of that, because patient has come to the hospital with difficulty breathing and dizziness. You say you want to tackle the dizziness and leave the difficulty breathing? Really? By the time you finish tackling the dizziness, I guess you have your patient gone already. You just call the mortuary people to come and take the patient away, because the oxygen. That's a lot in the body. You understand? This blood or red blood cells transport oxygen to the brain cells. Without oxygen, there is something we call hypoxia. Hypoxia, decreased levels or decreased concentration of oxygen in the body. And this will result in something we call ischemia. Ischemia, it's a there is not, no enough water or adequate supply of oxygen to that part. Until now, we shall say, what do one satu? Excuse me, say, our phone, we hear the one sat and then sat any to one saswa, we say, or don't know, when you better know, or we pajanity now on son, I say, of chocolate and chain. You see that thing? Because there is what? Insufficient blood supply. What does the blood do? The blood supplies what? Oxygen to all parts of the body, the tissues. You see that thing? Now, would your dredge is no one son? I hate it, because announce on your police, announce on your police. Sanity, a word deprived oxygen supply to the body tissues or to the tissues of that part of the body. That results in the ischemic condition that you get. Is that understood? So you have to prioritize the airway problem over prioritize the airway problem over other other patient problems, so that once you are able to solve that problem, you are good to go. Okay, then you know that this patient is now stable. You see, this patient is now stable. You can continue and do other things. Very good. Now, allergies. Okay, then you go to breathing. Breathing, so you check the breathing. So let's say with the airways, let me come back to the airways. You go to patients what airways, you check if there is anything obstructing the airways, if there is mucus in the airways, if there is anything preventing patients from breathing, that kind of thing. So if there is anything there, if there is mucus, people don't have a stroke, it's a vascular accident. So there is a care plan that has been prepared on stroke in the distance. People find it difficult to prepare care plans for stroke, care plans for, let's say, sickle cells, diabetes, cellulitis, conditions like cellulitis, hypertension, acute asthmatic, whatever attack, and then hypertension, preeclampsia, delirium, midwifery. Care plans are in. Midwifery care plans are in. Delirium, and then I think abnormal or something labor. Yeah, I've forgotten the topic, but they are all midwifery courses. They are just down there. I don't want to show you everything. Okay, so when you get the book, you can have access to all of them. All right. So, where was I? So the airways. I was talking about the airways. So make sure that everything is in place. The airway is patent. So if there is anything obstructing the airway, you should prioritize that first. You make sure you take that thing out before these patients can have what? A patent airway to ensure what? Breathing. And when that thing happens, breathing too can be what? Can be initiated. Non-dependent breathing well. So that you check, say, circulation. You can move ahead and check circulation. Say, you can press the new bed. You press here and we just check it. Say, oh, patient, saying mujano every 10. You see, within 3 seconds. Okay, within 3 seconds. It shouldn't be more than 3 seconds. When that thing happens, you see you have what? Impaired circulation. You see. Okay, so there are some hands raised. Gloria from Pong, Patricia. Okay.
Please, I can't hear you well.
Really?
Yes.
Does that apply to everybody?
No, please. Maybe it's your network. Check your network.
Anyway, she should.
Okay, Patricia, can you come in?
Say,
Hello.
okay.
Patricia,
Hello?
yes. You raise your hand.
Yeah, I was talking about this thing. The volume. I can't hear you.
Oh, okay. Okay. Then I'll have to
Okay.
increase my voice a little bit.
Yes, please.
Okay.
Yes. Okay. Thank you.
Then you're welcome. So we move on to the circulation. I was speaking about the circulation. The breathing too. You can actually put your head those when it comes to first aid. You can check if patient is breathing by observing the chest, the rise and fall of the chest, and then you can also put your the back of your palm or the edge along the nose, okay, to check if patient is breathing. Yes, that is where you can assess breathing. Yes, to ascertain which one to prioritize. So if patient is having difficulty in breathing, that is what you do to prioritize that situation over any other problem. Then you check circulation before you come to problems that pertain circulation and so on. There are a lot of things that you have to do. Then you go to allergies. So if patient is having allergies, you write the kind of allergies that this patient is having. So patient is allergic to lettuce. Patient is allergic to garlic. Patient is allergic to what? Spicy foods. So someone who has asthma, this patient is definitely allergic to dust. Let's say harsh perfumes or perfumes. You see? So you write those allergies there. If there is no allergy, you write no known allergies according to patient. No known allergies according to medical records. No known allergies according to medical records. Let's go to patient strength. The patient strength must correspond to the patient problems at the top. When we say patient strength is what you are going to, let's say the available resources that patient has or the nurses have that can help the problem or that can resolve the problem. Do you understand? The available resources that the patient, either the patient or the nurses or the healthcare facility, they have that can help bring down the problem. Is that understood? That's what we call what? Patient strength. So patient is having high body temperature. What can you, the nurse, do? What can a patient also do? So if patient can, so the patient problem is patient has high body temperature. Now listen, the patient problems too, there is a way to write them. I forgot to tell you that. If it is an objective problem, the one that the nurse saw on the patient, you state it like this. So let's say if it is high body temperature, you say patient has high body temperature. Patient has high body temperature. Patient has high body temperature. You see that thing? Patient has high body temperature. If patient is telling you, that is a subjective one. So patient complains of headache. Patient complains of headache. Patient complains of dizziness. Is that understood? Is that understood?
Yes.
Very well. Now we can continue to the patient strength. The patient strength, so patient is having high body temperature. What can you, the nurse, do, or what does patient have to help solve the problem? So I should go over that again. Alright, so I was saying that the patient problems, if it is the one that you, the nurse, you observed, you say patient has high body temperature. Patient has high body temperature. So for instance, temperature, the patient cannot tell you that, oh, my temperature is high, unless you, the nurse, you confirm by checking. Unless you confirm by checking using your thermometer. So then you can confirm. So therefore you see what? Patient has high body temperature. That is how you write it. If patient told you or patient tells you, then you say patient complains of. Patient complains of, and there are things that patient can tell you. You, the nurse, you cannot see unless patient tells you. Patient complains of what? Vomiting. Patient complains of dizziness. Patient complains of what? Headache. You understand? Patient cannot complain of high blood pressure. Okay? Patient cannot complain of high blood pressure. It is you, the nurse, that you can say patient has high blood pressure. Then you put the reading in brackets. Patient has high body temperature. Then you put the what? The reading that you recorded in brackets. So if it is high body temperature, what makes it look, or what makes it high, or what I mean confirms the reading? You have to put the reading in what? In brackets. Like what confirms your diagnosis, or what confirms the problem? It is a reading that will confirm that, oh, it's indeed that patient has what? High body temperature. So you put that in what? In brackets. Then let's go to the patient problems that was the strength that I was talking about. So patient has high body temperature. What is going to be the strength? The strength is going to be, let's say something like patient has money to afford what? Antipyretic medications. When we say antipyretics, they are the medications that if something is just an anti against, okay, pyresis, and so the high body temperature, high body temperature. So something that is against what? High body temperature. So if it's against high body temperature, it's definitely going to what? Bring it down. So antipyretic what? Medication. You see that then? So patient can afford. Patient being able to afford the medication is a strength, because if you want to give medication to a patient who does not have money, how can you what? Treat these patients? How does whatever goal that you have expected to achieve come to pass? Nothing. It cannot happen. So patient having money to buy the medications is what? It's a strength. Now you want to do tepid sponging for these patients. Patient doesn't want to what? To cope. How do you achieve your goal? So patient being able to cope with the tepid sponging is a strength. So when we say strength, although a patient is going through a problem, but patient can do this to solve it. Is that understood? Patient is going through or having high body temperature. This same patient can also do this to help subside the problem. Is that understood? Until a patient or go through problem but patient has a strength of telling the intensity of pain. Patient has the strength of telling the location of pain. Patient has the strength of telling the onset of pain. So a time a pain is shasi ne ya sanity location baby a pain. These are what? The strengths. Do you understand? These are all strengths that the patients can have. So depending on the kind of problem that you come across, you can think of the strengths to give them. So if it is vomiting, these patients can actually verbalize. Patient can verbalize the episode of what? Of vomits. Patients can actually verbalize the onset of vomits. Patients can also verbalize the color of the what? The vomitus. Is that okay? Very good. So yes, the frequency. Someone also added the frequency of vomits. Very good. Thank you. All right. So let's go through the routine care quickly. Then we pause here. God willing, tomorrow we can continue and then start to plan lots of what? Of care. And then have it in mind that before you plan care, you have to know about the condition before you plan the care. That is why in my nursing care plan group, there is this operation that I was on. It's called Operation Read a Diagnosis a Day. So in a day you have to read a diagnosis. You have to read on a diagnosis, because during the care plan you may not know the diagnosis that you'll be given. The reason I say you should read on a diagnosis is that, let's say malaria, you have malaria there, and the malaria, you've been giving patient problems like high body temperature and so on, headache. So you've gotten your diagnosis, acute pain. Now in malaria, what about malaria can cause the headache? That is where you'll be found wanting. Okay, that's where you'll be found wanting. That becomes a related factor. So without you knowing, you cannot what? Write the related factor. That's why I say you should read on a diagnosis a day. So when you are reading, you should know, say, you should also search for what about that condition that can cause the particular symptom you are trying to plan care for. Be care for the symptoms, the signs and symptoms. What about the condition? What about diabetes that makes the person prone to infection? Okay, or what about diabetes that makes the person have a risk for what? Infection. That becomes what? Related factor. So risk for infection related to so and so. Is that understood? So tomorrow, God willing, if we're able to finish the medication and other things, that part, we can begin with a condition, and our diagnosis will probably, let's begin with malaria first. Let's begin with the softest one, and then malaria is actually soft. So then we can proceed with other ones, other tough ones. All right, Comfort Nana Ekuya Adobia, you can speak. You said go over what?
The patient's strength. I didn't really get that.
The patient's strength. Okay, that's fine. So I mentioned earlier that the patient's strength is, let's say, patient is going through this a particular problem, but can as well as tell us something about the problem, or whatever the nurse is trying to do for the patient is willing to accept or undergo that procedure for the problem to be solved. So patient is having high body temperature. You want to do tepid sponging for the patient. You the nurse, you have planned, you've done your care already, your nursing care, and you've drawn it nicely. You go there, patient says, I don't want you to tepid sponge me. How can you achieve your goal? You cannot, right? But when patient says that, oh, I want to do it, okay, come and do it, then patient can cope with it. Patient can cope with what? Tepid sponging. And that becomes what? Patient's strength. Patient is having headache. Now, this patient says that, you ask patient, do you have money for medication? Patient says, yes, I have money. It's a strength, because without the money, how can you take care of the patient as well? So patients can afford analgesics. Okay, that is what? A patient's strength. Patients can verbalize the intensity of pain. Patients can verbalize the location. Oh, mitino, mitini hasi, fana na yao, ana metiko side no. Patients go through this trauma. problem in still to make her be funny. Neha, what I say? It's understood. Comfort, do you get it now?
Yes, please. Thank you so much.
You're welcome. Patricia, you can count me. Patricia, 2 Patricias. Patricia Square, you can come in.
Okay, sir, please, I want to. I'm a little bit confused here. Okay, sir, please. Patient has a severe pain and difficult in breathing. Which one will you prioritize first?
Okay. Severe pain.
Yes.
And difficulty breathing.
Yes, please.
Okay. Now,
Sir, please.
If-
Sir, please let me add high temperature to it. Please.
you want to add high body temperature to it?
Yes, please.
Okay. All right. Let's look at this. Patient is having difficulty in breathing. Okay. Patient is having severe pain. Okay. So this patient having difficulty breathing. If you go and then solve the patient's pain, you administer your medication. The patient is lying down. By the time you realize you turn to your patient, the patient is gone. What will you do? What will you do? Patient is lying down. And then you turn to your patient is gone. You tell me, what will you do? You see? So the breathing is very, very important. Do you understand? So you prioritize the breathing, you make patients stable. Now you can come and check the high body temperature. The high body temperature could be as a result of what? Infection. This high body temperature can actually cause patients to what? To become unconscious. You see, it can cause patients to have convulsion and so on. So you start treating what? The high body temperature. You tepid-sponge patients bed by bed. Okay, you tepid-sponge, you check. You tepid-sponge, you check again. And then when patients, when the high body temperature is not reducing, then you can what? Administer your analgesics, your antipyretics. Now this pain, we are saying severe pain. Where is the pain? If the pain location, depending on the location of the pain, if the pain is not at a place where it is detrimental to the patient's life, then I think the patient can come before the high body temperature. But if the pain is at a place where you find, let's say, chest pain, it could be as a result of a lot of things. Let's say there is this condition. Let's say the patient is having chest pain. It could be that there is insufficient blood supply to the heart, or there is what? Bronchospasms that is causing the pain. Patient is trying to cough and feels pain. Patient has chest tightness, feels this pain. So depending on the cause or the location, that will also determine where you should put the pain, whether the pain comes first, second, or third. Do you understand?
Yes, sir.
So it depends on what the location of pain. So if you say severe pain, I cannot tell you that the pain will come first or second. And then it also has to depend on the type of condition we are dealing with. That is why we are saying that the care plan is what? Individualized care, depending on the patient's condition. Now you know, oh, this one the pain I say you're solving it fast too, because pain, you know, the threshold now, maybe I do know, I will say to me the pain, I solve my patient, because this pain now patient you go through, no, it can cause what? Increase what? Blood pressure. Patient can be anxious. Patients can be anxious and can be what? Restless. So if patient is restless, can you even go ahead with what? Your care? No, you also have to come and solve the what? Restlessness. No? You reassure patients. You can also administer some medications like diazepam and so on. So what I say? to make patients calm so that you go ahead and treat other symptoms. Is that well understood?
Yes, sir.
All right.
Thank you.
You're welcome. Randolph. Last person, then we continue with the routine care quickly before we close.
So, sir, please, I want to get the clarification here. So, the patient's strength is based on the problems, right?
Yes. So it must correspond. It must correspond with it. So if you've written patient has high body temperature at the top, the strength must correspond. The first one must correspond to this, the problem. You understand the first problem?
Yes. Okay.
If it is
Yeah,
vomiting
thank you.
second, the strength too must correspond to what the second problem being vomiting. If it is dizziness third, the strength must correspond with what it must correspond to the what the third problem being dizziness. Okay,
Yeah, that's it. Thank you.
you're welcome. Let's continue the routine care. Now, TPR is temperature, pulse, respiration. How often do we check this? So the routine care, what we normally do on the ward. We know that for every patient, for every ward, we check routinely. We check the vital signs 4 hourly, right? We check the vital signs 4 hourly, right? Is that true?
Yes, please.
Yes. But
Yes,
Yes,
please.
sir.
for individualized care plan, you cannot say that because we do routinely is 4 hourly, so we are checking somebody who has a high blood pressure, BP 4 hourly. You will kill the patient. It's individualized care. In that case, you do something for that specific patient, unique ones for the patient, depending on his or her condition. So because of the high blood pressure, we are trying to monitor the BPs 15 minutes, every 15 minutes for 1 hour. After 15 minutes for 1 hour, we can what? Move on to what? Every 30 minutes for 1 hour. After every 30 minutes for 1 hour, we can move on to what? 1 hour to 4 hours. Every 1 hour, what? For 4 hours. After that, then you can what? 4 hourly when it stabilizes. Is that understood? So if time is not a year, you can write all of these things that I've said, but the space too is what is small. So you can just write check and record every 15 minutes, depending on the patient's problem. So that one too is depending on the patient. You're just not writing standardized stuff over there. Don't say that they've said I should check and record 4 hourly 7 times. No, the one who has understood or who understands care plan very well can know these patient problems. They know that so this patient is having this thing, high blood pressure. You are saying we should check this thing, TPR. Let's say BP. When we get to BP, we should check BP 4 hourly. Hey, you want to kill this patient? Oh no, max and also better. I'm telling you, patient is having high body temperature, and you are saying we should check temperature 4 hourly. Hey, is that so? Max and also better. So depending on the patient problems, you should what? You should know, or you should allocate specific time you'll be checking all of these vital signs. Is that understood? So that you attend. That is this talks about number of times you attend to your patients or you care for your patients. So every 15 minutes you want to attend to your patient because of what? The emergent or the how emergent the problem is, or how urgent the problem is. Okay, let's go to BP. So the BP is the same thing. Check and record every so and so time. The diet, depending on a patient's problem or diagnosis as well, you can determine the diet. So if it is hypertension, you cannot tell the patient or encourage the patient to eat high sodium diet and so on. So you tell patient to eat less, foods low in sodium, so you can say low sodium diet. Low sodium diet, you can say that low sodium diet. You can also say bland diet. If you say bland diet, it is a food without what? Spices. Bland diet. You can also say food rich in what? In protein. You can state all of those things. Protein rich foods, calcium rich foods. You can state those things. And then fluids. Copious fluid, liberal fluid. So these ones are when patient is allowed to take what? Enough fluids into the body. Copious, liberal. And then we have restricted ones, restrictive fluids. I don't know, according to what? Measurement. Or you can write what? IV fluids alone. The infusions from the amount and open a virtual. And if patient is not supposed to take anything by mouth, you say nil per os. You write it there. Nil per os. Nil per os. So everything, how you're supposed to write all of these things are written in the book. The breakdown is there. Everything is there for you to understand. Intake and output. So this is a procedure too. So over there, that one you write check and balance every 24 hours. Check and balance every 24 hours, or monitor and balance every 24 hours. Monitor and balance every 24 hours. This is intake and output. These are the fluids that patient takes in and the fluids that patient what brings out. So pertaining a condition that has to do with kidneys, kidney problems. We will work kidney problems now. Excretion, what problems, yes, we use this procedure for that patient. And then oral hygiene. So if the patient is we have types of oral hygiene. We have complete oral care, assisted oral care, and then we have, I think, yeah, that's that. So with the assisted one, and then okay, assisted, complete, I think there are two. So assisted one, so let's say patient can do it by himself or herself, but you have to provide little assistance. We are the Pepsodent, but so use some toothpaste, about toothbrush, someone know I had a tree. Watch and say, oh, she ha, you say, what should you someone, you are assisting patient, assisted mouth care twice daily. Then you state that the items that you use to do that. If it is complete mouth care, you did it for the what? The patient. You did it for the patient. So and only here, let's say you use something like forceps. That is when patient is unconscious. You use forceps, spatula, and so on to do it for what? The patient. If patient did it himself or herself, you say twice daily, what? Using toothbrush and toothpaste. So if it is complete mouth care, you can write that complete mouth care using this thing, spatula, forceps, and so on. And then the chemical you use, it can be hydrogen peroxide. Then you state that as well. And then the bath twice daily. The bath too, we have types: assisted bed bath, assisted bathroom bath. We have complete bathroom bath, complete bed bath. That one too is there. Okay, so it states the one that you did for the patient or you be doing for patients. No idea at all. Yes, so that one too twice daily, and then you state the equipment you use to the things you use for the patient or to do this procedure. So towel, sponge, soap, and water. You state them there. And then urine testing. So if there was any urine testing requested, then you state it there. If there was no urine testing requested, you just write not requested. So urinalysis, you can write culture and sensitivity test and so on. You can write serial urine collection. That one too is there. So the type provided in the scenario is what you you write there. If it is not requested, you can write what? Not requested. Body weight, weight of patients, then you write that there. It can be provided in the scenario. If it is not provided in the scenario, you can also write done on admission. Done on admission. And then activity. This is how patients, let's say on the ward, how patients engages in activity, if patient is ambulant, if patients can walk or cannot walk. So if patients can walk, you write ambulant. So if patients can walk by himself or herself, you write what? Ambulant. So if patients can walk with assistance, you can write what? Ambulation with what? Assistive devices. Then into brackets you state the what? The assistive device that the patient is using to walk. So if it is Zimmer frame, if it is crutches, you state that as well. Yes. So if patient is not ambulant, if patient cannot walk, patient is unconscious, patient is in bed, you can write what? Bedridden. 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 Alright. Do you have any question? Augustina Daniel.
Yes, sir. So please, I want to ask about the fluid. You said in case the person is cannot take food per mouth, you write meal per us.
Yes.
So I want to ask, is there any instances that the patient will be meal per us and having IV fluid? If yes, then how will you take it? Thank you.
You said what? If patient has nil per us but will be taking what? IV fluid.
IV fluid, yes.
Yeah, so
How will you take it?
yes, so you write nil per us. IV, you can write okay, you can just write the infusions over there. You can just write IV fluids there. Okay?
Mm.
So IV fluids,
Okay,
then you
okay.
put into brackets the fluids that were given. If it is Ringus, if it is normal saline, you put it there. If it is DNS, you put it there. Okay?
All right, sir. Thank you.
Okay, you're welcome. Does anybody have any question? So this session, we give glory to God for such a wonderful moment that He has brought us. Let's say a short prayer, and then we proceed with other announcements. Heavenly Father, we thank you for such a successful moment, successful class. We appreciate your glory, your blessings upon us. We pray that let everything we've learned here stuck into our brains, so that God willing, when we get to the exams, or we shall be able to recall, write the exam successfully in Jesus' mighty name. What we look for is win and success in this. In Jesus' name we've prayed. Amen.
Amen.
Any question that anybody wants to
Amen.
So this program or this moment is sponsored by the incoming SRC president called Fred. Okay, so with lots of goodies that we want for everybody, we urge you that the day that everything is done and you will be told to go to campus and cast your vote, you do that for him. Okay, with the great ambitions, the visions that he has, so that Wisconsin will be resetted, or the SRC will be resetted, for the student's voice will be heard out there. We pray that all of these things will happen in Jesus' name. Okay, so the middle part we shall continue, God willing, tomorrow. Please, if you need a copy of the care plan book, you can send me a text on WhatsApp. My telephone number too is 0545 254410. All right. Mr. Fred,
Please, the number again.
0545 254410. 0545 254410. Okay, so God willing, tomorrow after everything, we shall have a talk again. God bless you too. Have a very good night. Bye-bye.
Bye.
Bye.
Thank you, sir.
You're welcome.